Hey Paraphies, hi. Today we're going to talk about lymphoma diagnosis.
You cannot detect the problem in your body by doing a single Google search. The answer to your question of what has happened to me is answered by the process of diagnosis.
To recognize the correct disease is not that easy. The patient needs to go through a series of tests like blood tests, imaging tests, biopsies. Along with these, the health history and physical examination done by the doctor provide important clues to us finding out the real problem.
In this video, we are going to take you to the whole procedure of diagnosis, where every test marks a deciding checkpoint leading to the more specific test and finally pinpointing the accurate disease. And the disease we are going to look into today is lymphoma.
Lymphoma is a type of blood cancer that develops when white blood cells called lymphocytes in the lymphatic system go out of control. But how do you know if that's what's happening inside a patient's body?
Yeah, that's right. The patient shows myriad of signs and symptoms, which are like jigsaw puzzles for the doctor to solve. Cause there are many types of lymphomas, and their manifestation differs significantly with every different human being.
But the most common symptoms are swollen lymph nodes, fatigue, unexplained weight loss, night sweats, often called as drenching, and itching. This is where the role of diagnosis comes into play.
The first and foremost is the health history of the patient, which is a crucial point in deciding the direction of the diagnosis procedure.
But remember, not all diseases are essentially related to the health history. Like lymphoma, which is not inherited and thus cannot be passed on like any other type of cancer.
So, how do we know what causes lymphoma? Well, we don't know that either. But the main risk factors are problems related to the immune system.
What after this? It's time for the physical examination done by the doctor. This involves checking for swollen lymph nodes in the body, forming lumps, especially in the neck, armpit, and groin regions.
But wait, that means you have a lymphoma? No, not really, as the swollen lymph nodes can be manifestation of any other viral infection.
So, what the physical examination does, it only suggests towards more specific tests that can provide us with more accurate diagnosis. And these tests are usually blood tests.
Now, as we all know, blood tests are also regularly done by people during their health checkup. These blood tests provide useful insights into the patient's overall health.
Other than finding the complete blood cell count, these blood tests also look for any abnormality in the ESR, LDH, and CRP results. These tests detect any change in the characteristic composition of the blood.
Does this confirm lymphoma diagnosis? No, absolutely not. It only led us more closer to understanding the problem in the body through a wider perspective.
Once the doctor finds out that the signs and symptoms along with the blood tests suggest lymphoma, further more accurate tests are carried out to confirm the hypothesis.
Once the detailed checkup of the blood is done, we move towards imaging the body using different tools and techniques in 2D and 3D forms. These are used to detect the swollen lymph nodes.
In most of the cases, lymphoma is picked up on an X-ray, and in such cases, the most confirmatory test for cancer, that is a biopsy, is recommended. A biopsy is a minor operation in which the sample of a tissue is taken out from the body and is looked at under a microscope for abnormal or cancerous cells. It is one of the major ways to diagnose most types of cancers.
So, in the excision biopsy, where the whole swollen lymph node is removed, not only helps in confirming the diagnosis but also in the identifying the type of lymphoma. Based on the presence or absence of Reed-Sternberg cells in the removed tissue, it is classified into Hodgkin's and non-Hodgkin's lymphoma.
Yahoo! Now that we know that the person is suffering from lymphoma, have we come to an end of the diagnostic procedure?
No. The process of diagnosis doesn't end at simply knowing the cause of the problem, but also checking its progress.
And this progress check is done by determining the stage of the cancer. This staging procedure requires the use of positron emission tomography combined with computed tomography or the PET CT scans of the chest, abdomen, and pelvis.
The PET scan is basically an imaging technique that involves injecting a radioactive form of sugar into the patient's body before the scan. The actively dividing cancer cells take up the sugar and can be easily identified as the hot spots on the scan.
While the CT scan uses a number of narrow X-rays, taking multiple images from different angles. These images are then analyzed by a computer and put back together to form a very detailed three-dimensional picture of the organs.
A combination of these two reveals information about both the structure and function of cells and tissues in the body during a single imaging session. This helps the doctors to figure out the stage of the cancer.
Knowing the location of the lymphoma cells in the body is especially important to identify the stage of the cancer, whether it is stage 1, 2, 3, or 4.
Bone marrow biopsy is carried out to check if the lymphoma cells have reached into the bone marrow. This usually happens in stage 3 or 4. Even with an anesthetic, it is a very painful process.
Other than these scans, the doctor might recommend an MRI, that is, magnetic resonance imaging, if the lymphoma of the central nervous system is suspected. If so, a lumbar puncture is carried out. Also called as the spinal tap, the test looks for lymphoma cells in the cerebrospinal fluid. The results from the test in turn helps the doctor to decide upon whether or not the central nervous system should undergo treatment.
Finally, diagnosis, as we described in the beginning, is not only about identifying the real problem but also about regularly checking its progress and deciding upon an effective treatment plan.
Once the type of severity of the lymphoma is known, it is treated with a typical chemotherapy or radiotherapy. Thus, the process of diagnosis is critical towards ensuring an effective treatment and safety of the patient. Thank you.